in the primary endpoint analysis that's already been published more than a year ago in the GAIA trial, we looked at undetectable MRD rates, and we looked at progression-free survival differences between the arms. These were the two primary endpoints. In the primary analysis, we were only allowed, as per protocol, to compare venetoclax-obinutuzumab and venetoclax-obinutuzumab ibrutinib with the chemoimmunotherapy arm, and they were both more efficacious in terms of progression-free survival compared to chemoimmunotherapy, but we didn't really have any information or any statistical tests to look at the differences between the venetoclax arms. And so what we did now with the follow-up analysis is that we analyzed the differences between the venetoclax arms, and what we found now was that venetoclax-obinutuzumab and venetoclax-obinutuzumab ibrutinib, so the doublet and the triplet, they were both more efficacious or superior in terms of progression-free survival compared with the chemoimmunotherapy arm, but also the venetoclax rituximab arm, so the third venetoclax arm we looked at. And I think a special focus was also put on the comparison between the approved doublet of venetoclax-obinutuzumab and the experimental triplet of venetoclax-obinutuzumab ibrutinib. And what we found there was that in general, we didn't see a significant PFS difference, but the curve separated quite clearly. And when we looked at the largest subgroup of patients, which is the patients with unmutated IGHV, so the higher risk patients with a more dynamic disease, that they actually benefited from the addition of ibrutinib, and we saw a significant PFS benefit in the triplet arm compared to venetoclax-obinutuzumab.